Hello, I'm Jerry Shapiro. I'm a professor of dermatology at New York University. I am director of the disorders of hair and scalp, and I'm one of the few dermatologists in the world who just devotes his entire practice to hair only. That's all I do. So all I see is hair loss day in and day out. And I've been doing this for almost 40 years. Well, the peak and trough profile is from the immediate release, in that you get these high levels that can actually be cardiotoxic in some individuals. I've had a patient who had pericarditis from this medication, the immediate release. So, and he didn't even want to go off of it because he felt it worked and grew hair, but we had to get him off of it because of the side effect profile of the pericarditis. But the point is, there are cardiac side effects with this, and we want to make sure that when we give this medication, that the steady state, we don't go above the cardiotoxic level. It's much lower than that, and so as a result, we're not really worried about any cardiac symptoms that we may see, with the immediate release, because it can go up quite high above the cardiotoxic level. And so we have to be careful. The slow release does not. Well, I want to see efficacy to be continued, which I feel confident it will happen. I want to see it in a large group of people. I want to see the rapidity of response. And I also want to see patient-reported outcomes. 90% of the people in this phase 2 study were very happy. The FDA likes PRO, patient-reported outcomes. If you have something that's 90% causing great patient-reported outcomes, we're happy with that. Nothing does that, actually. Any medication that I've used for female pattern hair loss, I don't have a 90% PRO. So this is quite a big deal. I think this is a milestone in that we have something new that's going to be FDA approved, oral, for women. We had nothing before. And the last thing that was approved was decades ago, was the topical minoxidil foam. Okay, and so now we have something oral, we have something that works quickly, something that works very well. And so it's really a very important medication that's new and will allow patients to be more happy. We'll have a larger number of women happy with this medication. In that the side effect profile is, in terms of cardiotoxicity, doesn't really exist as far as we know. Nothing's been shown so far. So I'm quite happy using this and using it to be the go-to medicine.